welcome. We appreciate y'all coming to our fall event. It used to be called the Evening of Glamour. I guess we can still call it that. And thank you to my staff for putting this together and being here late. And thank you to our model, Miss Tara, for coming in and allowing us to do some injections. So without a whole lot of delay, what we're going to do is we're going to do an injection here for Miss Tara, and we're going to inject the nasolabial folds here. So in a moment, she has a little numbing cream on, which is something that we do for all of our patients, or we offer for all of our patients. And what we're going to do is do some injections here with a filler called Juvederm to elevate the nasolabial folds and soften this line that kind of develops in many people, kind of from the corner of the nose down toward the corner of the mouth. This is probably the most common, maybe the second most common thing that we do with Juvederm. The other would be that we use it for lip augmentation. And so we can make lips fuller with it, and kind of the sky's the limit, and it's always the patient's choice with lips. We can do subtle things just to help restore some of the volume that many patients lose as they age, particularly in the top lip. We can do things that are a little bit more full and a little bit more dramatic. And then for those who want, we can make them look, you know, pretty large and even kind of stylized. And so different people have their own with Juvederm, yeah. And different patients, you know, have different desires and expectations, and so we try to understand what you want and give that to you. And most of our patients actually want things that are just kind of natural looking but a little bit fuller, so that's what we're doing most of the time. So that's the lips, and we're going to do the nasolabial folds here. So while I'm putting on some gloves, does anyone have any questions? How long will this treatment last? So this product lasts about 1 year. So most patients, if they like the result from this, they don't wait for a year, because, you know, if you think about it today, if we kind of fully correct this area, in a year it's all gone. Most patients every 4 months or 6 months or so will put a little bit more product in there just to kind of maintain the result. And many patients are also having Botox treatments at the same time, and the typical interval for that is also 3 or 4 months, so it kind of matches up with that. So first thing we're going to do here is we're going to wipe off the numbing cream, and going to clean the skin a little. And can open up the magic box of Juvederm. So if you didn't hear, those who might be watching on video, the question was, have you had this before? And Miss Tara says no. And no one's asked, would I have done this before? A few thousand times, a few 10,000 times, I think, at this point. So let's see here. All right. So if you look here, I think everyone can see this kind of line here on her face on each side. And so let me take a look here from the front. So I'm going to start on this side here. And feel just a little stick here. And this Juvederm also has some numbing medicine in it. So the skin's numb from the numbing cream. This is a super fine needle. Many people don't even feel the needle stick. And then as the product goes in, it has some numbing medicine in it. So as you see me kind of come back and do multiple injections, you feel them kind of less and less. Did that hurt?
No.
No. And she was pretty nervous. Is that fair to say?
Mm-hmm.
Yeah, so. Okay, relax and try not to smile even though we're making you look younger. Let's see here. Okay, so I'll let you Megan, let's see, you sit up nice and straight here. You kind of make sure you get that shot kind of straight from the front. And then if you'd be so kind, I'll let you turn over here so this group can see. So can you see the difference? And then try not to smile. You see the difference between the left and the right there? So it's a subtle thing, and I think injectable cosmetic treatments are kind of best when they're subtle because they look very natural. And it only takes a change of a few millimeters in most cases to kind of make, artful changes to the face that kind of restore a more youthful appearance. Because if you look over this way, yeah. Can you see the difference? Which is this? Yeah. Yeah, so this, these are called, the class of what this is in is called a filler, F-I-L-L-E-R, because it goes in and it fills up volume and lifts up wrinkles. So, now, we'll go ahead and do the other side. And I think if we did this, I don't think she's going to go back to work and anybody thinks she looks strange or odd or overdone, right? Nice and steady here. There you go. Okay. So I'm going to stop here for just a second and let you take a look again. So you see we've mostly corrected this line or this fold here at the top, but she still has a little bit that persists down here. This is actually a dimple. I don't know if you can see that from the back. There's a little dimple here. And we're going to soften that a little bit too. You can't make dimples go completely away because when you smile, the muscle kind of pulls the skin in. That's what makes the dimple. But we can definitely soften it if they're kind of present even at rest. So, all right. So I'm going to let you take a look over this way again. So on this side, she has a little bit more aging, particularly in this area. And so we've kind of treated the top of the nasolabial fold here. And now I'm going to actually come down, do a little bit more down in this area. I think maybe you can see that she shows her age a little bit more in here than she does on this side. Can you see that? I'll let you look over this way. So can you see that kind of in this general area she shows her age a little more on this side than she does on this? So I'm going to see if I can do a few more little tricks here to soften some of that as well. Let's see here. 52? Oh. Sorry. I'm sorry. Did you hear her answer? I'm being the class clown. Let's see. All right. All right. Just relax as much as you can there. And this is an area too, when we get into these little more superficial lines, sometimes we use some of our other products that are a little thinner, that are formulated a little bit more to be used superficially. But with a lot of experience, sometimes you can get by with just we can get you through with only having to purchase one product. Okay, so relax here as much as you can. All right. Still doing okay? Mm-hmm. So does this hurt more or less than you were thinking it was going to? Less? That's good. I didn't know what she was going to say. All right. Now we're starting to get our skin a little irritated from rubbing and wiping, but all right. I'll let you take a look at that. So why don't you turn over that way. I'll try to dab this off. Let's hold this for just a second. So you think I did a little more good down here? Yeah. All right. And then look back this way. So. All right. So I'll let you hold a little bit of pressure right there. Does anyone have any questions? Okay. Well, thank you very much for coming, and thank you for volunteering for us.